Hello, everyone, and thank you for joining us this evening for our question lab. Our topic today is public health sciences. So leading our discussion once again is Faraz Fakari, and Faraz is going to introduce himself now.
Thank you, Sean. Hey guys, my name is Paris. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. I also work with USMLE-Rx as an RX coach, and I work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
We'll go ahead and begin with our first question of the evening. As you can see, the answer choices are covered up. That is by design. We don't want the answer choices to dictate or guide your thought process, and we certainly don't want you to see an answer choice that you are unfamiliar with that may cause you to panic as you're trying to answer the question on test day. Once we cover up the answer choices, we'd like to begin by reading the lead-in. The lead-in is the last sentence or the question itself. So here we go. Which of the following is the most appropriate next step in management? And the reason why we read the lead-in first is because we want you to know what the test writer is asking. That allows you to pick up the relevant clues as you're reading the vignette, and hopefully will prevent you from having to reread that question and waste time on test day. Once we read the lead-in, we'd like to ask our students how many steps they believe this question will require. An example of a one-step question could be, what is the diagnosis? An example of a two-step question could be where they ask you, what is the treatment for a diagnosis? And an example of a three-step question could be where they ask you, what is the mechanism of action for a treatment for a diagnosis? So I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. I see some responses coming in. So let's go ahead and read that vignette. A 28-year-old woman comes to the clinic to establish care as a new patient. She reports a 1-year history of generalized abdominal pain, fatigue, and headaches. She also reports that she often worries about her symptoms so much that she has difficulty sleeping. The patient's mother has rheumatoid arthritis, and an aunt has systemic lupus erythematosus. The patient has no nausea, vomiting, diarrhea, constipation, fever, chills, weight loss, chest pain, or shortness of breath. Her menstrual cycles are regular. She reports having seen multiple doctors over the past year and recalls having negative blood work. CT scan of the abdomen showed no abnormalities. She takes no medications. Vital signs are within normal limits. Heart rate is regular and the lungs are clear bilaterally on auscultation. The abdomen is soft and non-tender without masses. There is no rebound or guarding. Range of motion is full in all extremities. So once again, which of the following is the most appropriate next step in management? I want all of you to start thinking about the important and relevant clues in the vignette as I hand it off to Boris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in the vignette and the lead-in. And first and foremost, demographics. Whenever you have the age and demographics there, it always kind of helps narrow down your differential and give you some clues as to what may be going on. So here we have a 28-year-old woman. The signs and symptoms she's presenting with are also important to make note of, and the duration as well. So she's had these going on for 1 year. They also gave us some additional information in that she worries about the symptoms so much that she has difficulty sleeping. Whenever they give you something like that, they kind of had to intentionally put something there, it's always important to make note. Why are they giving that to you? Okay. In this situation, they also gave us a lot of negative review of systems. So they asked her a lot of questions, and she had a lot of negative answers to those questions. They gave us some information about who she's seen, some blood work, some imaging, all important as to whether they were positive, whether they were negative, what they showed, and then some physical exam findings as well. So then when we talk about the lead-in, this is asking specifically the most appropriate next step, okay? So how many steps is this question? Well, I think this is probably a two-step question. I think one, we need to figure out what's going on with her, whether it's a diagnosis or a condition. And then two, based off that, what would be the next best step in terms of management? So probably a two-step question. Let's go ahead and take a look at the answer choices. And so what we see 5 answer choices here. And what we're going to do is we're actually going to start with answer choice E, and we're going to work our way to the top. The reason we recommend that students do this is because this way it kind of helps you avoid biasing yourselves. A lot of times we'll see students who start at the top, they'll see something they like, and then they'll select that without having gone through all the choices, and then they'll get that question wrong. So this way it ensures that you're not biasing yourself and that you're going through all the answer choices. So we'll go ahead and do that now. Answer choice E, regular outpatient visits with same provider. D, referral for psychiatry consultation. C, referral for gastroenterology consultation. B, admit for hospitalization. And A, abdominal X-ray study. So we're going to go ahead and open up that poll. Go ahead and select the answer choice that you think would be the most appropriate next step for this 28-year-old patient, and we will talk about it in just a few seconds.
Excellent. Thank you, Para. So the poll is open. We'll give all of you a few moments here. Remember, just never to leave a question blank untested. There is no penalty for guessing. This evening, all of your responses are anonymous. So if you are unsure, take your best guess. Then we will go over the correct and incorrect answer choices. Remember that by actively learning, by participating, you're going to get more out of tonight's session. So be sure to select an answer. As always, we do have a raffle at the end of the evening, so make sure you stick around because you must be present to win. And let's see, looks like there was a clear favorite with 50% of you suggesting E, regular outpatient visits with the same provider. In second place with 32% was referral for psych consult. Let's go ahead and take a look and see what the correct answer is. And the correct answer is, in fact, E. So great job, everyone. Let me hand it back to Paris.
Thank you, Sean. Great job, guys. So this patient, she's a 28-year-old female, and she's got a history of essentially anxiety regarding a few, kind of vague and various signs and symptoms. And on the next slide, on the vignette, we can actually see some of those signs and symptoms. Her abdominal pain, she's got fatigue, headaches. The thing is, all of her workup has been normal. So her blood tests have been normal. A CT of the abdomen showed no abnormalities. So this kind of makes the diagnosis of somatic symptom disorder most likely. So it's a disorder where you have a variety of unexplained symptoms like abdominal pain, weakness, that cause distress to the patient and impair their daily function. And these patients often have excessive thoughts with their symptoms and about these symptoms. The best management for these patients is that they establish care with the primary care physician and have regularly scheduled outpatient visits with that same provider. You can also incorporate certain types of therapy as well, but an established patient-provider relationship is really going to be what's helpful, because then you can understand and legitimize that patient's concerns. And then it can also help provide or minimize, unneeded testing, unneeded imaging, and the utilization of emergency resources. So answer choice E would be the best answer here. Looking at the other answer choices, I know the second most highly selected answer was psychiatry consultation. This is probably not indicated at this time because this could add to the patient's frustration and dissatisfaction. And especially with step 1 questions, it's best to avoid referrals to a specialist. They're likely unnecessary at this point, especially in this question where there's a better answer. C, this patient does have a history of generalized abdominal pain, but her physical exam is normal, her CT abdomen was normal, so referring to a GI doctor is probably not most appropriate at this time. And this patient's also medically stable with normal vital signs and normal diagnostic tests, so admitting for hospitalization would be inappropriate. And then lastly, abdominal X-ray. We already have done a CT or have the results of a CT abdomen that showed no abnormalities, so an abdominal X-ray is probably not going to add much more. On the next slide, we've actually gone ahead and pulled up a table from first aid that talks about these somatic symptom disorders, okay? So these symptoms are unconscious. The patient doesn't know that, they're not bringing it on consciously, okay? And specifically with somatic symptom disorder, you can see that they have more, at least one bodily complaint lasting for months to years, and the patient has persistent thoughts and anxiety about it, okay? The treatment is regular office visits with the same physician, often in combination with psychotherapy, okay? So that would be the best treatment for someone with somatic symptom disorder, and that's why answer choice E was the best answer in this question.
Excellent. Thank you, Paris. Great job, everyone. Let's go ahead and keep the momentum going as we move on to our second question of the evening. Once again, the answer choices are covered up. That is by design. I see some people just joined us. I'll explain why we do that. We do that because we want to make sure that you are not jaded or guided by those answer choices. We also want to make sure that if you see an answer choice that you are unfamiliar with, it doesn't cause you to panic as you're answering the question. After that, we will read the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to be able to pick up on all the relevant clues in the vignette on your first go around so that you can answer the proper question correctly and quickly without having to reread the vignette and waste time. So let's go ahead and read that lead-in. Which of the following most appropriately describes the error that occurred? Which of the following most appropriately describes the error that occurred? I'll give all of you a few moments to let us know in the question box how many steps you think this question will require, and then we'll move on and read the vignette. All right, I see some responses coming in, so let's go ahead and read that vignette. A 34-year-old African-American woman, gravida 2, para 1, at 37 weeks gestation, is brought to the emergency department because her water broke. She underwent a cesarean delivery for her first child. She is immediately taken to the labor and delivery room. After undergoing uncomplicated labor, she delivers a healthy baby boy vaginally. Immediately after the birth, the physician notices vaginal bleeding, but the patient does not report any pain. The physician notices that the delivered placenta is not intact and makes a presumptive diagnosis of placenta accretia. In order to stop the bleeding, the physician decides to perform a hysterectomy. During the operation, the physician accidentally severs a ureter despite properly identifying both ureters earlier in the procedure. Which of the following most appropriately describes the error that occurred? Paris.
Thank you, Sean. So we're going to go ahead and show you what we think are the most important clues in the vignette and the lead-in. And again, demographics. So they're telling us this is a 34-year-old African-American woman. And this is actually a reproductive or pregnancy type situation. So it's important to take note of how many weeks pregnant she is, how many pregnancies has she had, how many have been successful. We do then also know that, we're given some clues about what led to her being taken to surgery and what the physician did. He decided to perform a hysterectomy, and then they told us about something that happened during the operation, and they gave us some additional clues about what the physician was thinking, what the physician saw. And in this type of question, that's going to be important. The frame of mind of the physician, what had they done previously leading up to that point as well. So it's important to take note of that in this type of question. Now, specifically with the lead-in, it's asking us about an error that occurred and for us to describe that error that occurred. So how many steps is this question? Well, I think probably a two-step question. I think one, we need to figure out what happened in this situation. What would we call that? And then two, what type of error is that? So what happened in this situation, and then 2, what is the name for that, or what is the description of that? So maybe a 2-step question here. So let's take a look at those answer choices. And again, we will go ahead and start at the bottom and we will work our way up to the top. Answer choice E, slip. D, rule-based mistake. C, never event. B, lapse. And A, knowledge-based mistake. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you so much, Boris. We'll give all of you a few moments here to select your best response. And then as always, we will go over the correct and incorrect answer choices. Remember that when you're reviewing questions, it's always important to make sure you review all of the answer choices and explanations. Even if you got it right, you want to make sure you got it right for the right reasons. So you also want to review the incorrect answers so you can get the maximum benefit from each practice question. And later on in the evening, we will walk you through our new QMax explanations and format. I think you guys will really like it. We also have a raffle, so make sure you stick around until the very end. And let's see what all of you selected. This is pretty close. So 30% of you selected slip, 26% of you selected knowledge-based mistake, and 23% of you selected never event. So let's take a look and see what the correct answer is. And the correct answer is E, slip, and 30% of you got it right. Obviously, it was a challenging question, but don't worry, Boris is going to explain it to you now.
Thank you, Sean. Yeah, definitely a tough question here. So let's take a look at this question. So on the next slide, actually, we kind of, Sean has actually gone ahead and pulled up a little algorithm or flow chart that kind of talks about some of these errors. So errors can really be divided into 2 broad categories: execution failures and planning failures, okay? Execution failures occur when the intended action is appropriate, such as in this patient, where the physician did an emergency hysterectomy in the setting of placenta ekrata. But execution failure is when it's carried out inappropriately, and thus the intended goal isn't achieved. There's 2 types of execution failure: slips and lapses. A slip is an error of attention, okay, which most likely describes what's going on in the situation because the surgeon accidentally severed the ureter in spite of performing all the previous proper steps, okay? So the pressure to remove the uterus as quickly as possible probably served as a distraction, and thus this physician had a slip, okay? A lapse is another type of execution failure that commonly occurs as a result of an error in memory, okay? So an example of a lapse in this setting would be, let's say if the surgeon forgot to identify the ureter and then subsequently severed the ureter. However, in this case, we were told that he did previously identify both ureters. So it was not a lapse in memory, it was more of a slip in attention, okay? Now, planning failures are divided also into 2 types. You have knowledge-based and rule-based mistakes, okay? So planning failure occurs when a person has an intended goal, but ultimately kind of chooses the wrong way to accomplish the goal, and thus the goal is not achieved. So for example, in this scenario, if the physician had tried another way of stopping the bleeding, okay? And so in general, in this situation, this would be considered an execution failure because the intended action was appropriate, but was carried out inappropriately with the goal not being achieved. And between the 2, this was more so issue with attention, not as much memory. So this would be better characterized as a slip. So let's go back to our question and look at the other answer choices. So we talked about why this would be a slip. Talking about a rule-based mistake, as we just mentioned, this is a type of planning failure, and it can occur as a result of 2 causes: misapplication of a good rule or application of a bad rule. That's not really the case here because the physician perform a hysterectomy for this, which is appropriate, so it wasn't an application of a bad rule, okay? A never event, answer choice C, that's something that's very egregious that can sometimes occur in healthcare settings that really should never occur. So it's doing what's called a wrong site surgery. So let's say you replaced the right hip in a patient who was scheduled to have a left hip replacement, or the death of a patient if you gave them a medication and they had a clearly listed allergy to that medication. Those would be never events. This is not a never event. An injury to the ureter is always a risk in any of these type of gyne surgeries, and it is expected to occur in a very small minority. So this wouldn't be classified as a never event. We just talked about what lapses and how that's more of a failure or issue with memory, okay? And a knowledge-based mistake as well, as we talked about, that's a type of planning failure that occurs because of improper planning of procedures, which is not the case. There was appropriate planning and decision to do a surgery. So the best answer choice here is answer choice E, and we'll go back and take a quick look at that algorithm one more time so you guys can let that sink after we talked about the other answer choices, and hopefully kind of walking through it this way helped you understand these types of failures. So hopefully you can get it right on test day.
Excellent. Thank you, Paros. Another challenging question, but great job to everyone. Wonderful explanation. So I'm sure you guys will all knock it out of the park on test day. Now, we talked about RX coach briefly earlier, and you met Paros, who's a derm resident, and Ari, who just matched. We have a wonderful group of coaches who work individually with our students to help them accomplish their goals. And those goals could be doing well in exams in medical school. It could be doing well on comprehensive assessments. It could be the USMLE step or COMLEX, step 1 or step 2. And the first thing we do is we administer an assessment. And that's unique because we have actually authored our own assessments, right? So anytime you want to get help from somebody, you want to go to an experienced team. And our team has had about 30 years of experience educating medical students. So we've authored our own resources and we administer one of our assessments, and then we use that assessment to get a baseline and get an idea of what your strengths and weaknesses are. And then we use that to come up with a personalized study plan. And that personalized study plan is going to save you time and make your study efforts more efficient. And we hear that all the time. It'll take the guesswork out of you asking yourself, hey, what should I be doing now, right? And you can go online, you can ask your friends, and they'll all give you different advice. But remember, what worked for them may not necessarily work for you, right? Because we're all different. We learn differently. We think differently. We apply what we know differently. So if you want that individual attention, the individual approach, not only work on your knowledge and content, but also to work on your test taking skills, reach out to us at rx-coach.com. That's rx-coach.com. You can click on the free consultation tab to discuss the tutoring program, the coaching program, and how it can benefit you, okay? We'll be happy to talk to you and see if this program is a good fit for you. As you can see, we have a really, really high student satisfaction rating. Even earlier today, we got earlier this week, we had one of our students take an assessment and ended up with a 260 plus with some time still left to go. So we've had a lot of great success with it, and we'd love to make you one of our success stories. So once again, that's rx-coach.com. With that, let's go ahead and get into our third question of the evening. As you can see, the answer choices are covered up once again, and we will begin with the lead-in. Which test would be most appropriate for this task? Which test would be most appropriate for this task? So we will give you a few moments here to let us know in the question box how many steps you think this question will require. And then we'll move on to the vignette. All right, I see the responses coming in. Let's go ahead and read that vignette. To evaluate different thrombolytic therapies in patients with cerebrovascular accident, researchers conducted a meta-analysis to investigate the time to resolution of symptoms with 3 different thrombolytics. Using the results from multiple independent studies, the investigators calculated the mean time to symptom resolution after administration of alteplase, urokinase, and streptokinase. The researchers would like to perform a parametric statistical analysis of the data. Which test would be most appropriate for this task? I want all of you to start thinking about the important clues in this vignette as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go through and tell you what we think are the important clues in this vignette and the lead-in. So, when you first read that lead-in, you can tell that it's asking about a test. And then, clearly they're giving us some sort of study here, okay? They're specifically asking about thrombolytic therapies. This study was a meta-analysis, okay? And then it's important also to take note of what their outcomes were. How did they do the statistical analysis? And they're specifically asking about maybe what statistical test did the researchers use. So in that situation, we know we're going to have to get those clues from the vignette to help figure out what would be a good statistical test to do. So that's what we highlighted. We highlighted that there were those different groups, what those groups were, what their outcome was, and that's going to be important when we talk about the correct answer in a little bit. So in this lead-in, what's important? Well, again, the test that's most appropriate for this task. So how many steps is this question? Well, I think this is probably a two-step question. I think one, we need to figure out like what are we calculating, what are we trying to figure out? And then based off of that, what test could you use to complete that? So probably a two-step question here. So let's take a look at those answer choices, see what we're working with. And as you can tell here, we have a few fun answer choices. We have answer choice E, which is a z-test, D, which is an independent t-test, C, a dependent t-test, B, chi-square test, and A, analysis of variance. So once again, take a look at that vignette. Determine what you need to best answer this question. We'll go ahead and open up that poll. Go ahead and select the test that you think is most appropriate, and we'll talk about it in just a few seconds.
Excellent. I see the responses coming in. We'll give all of you a few more seconds here. As always, we do have a raffle and a special offer for all of you in attendance, so make sure you stick around until the end because you must be present to win. All right. A few more seconds here. All right, I see responses coming in. For those of you asking, our topic next week is immunology pharmacology. And let's take a look and see what all of you selected. And it looks like there was a clear favorite here. 55% of you selected analysis of variance, and second place with 27% was B, chi-square test. So let's take a look and see what the correct answer is. And the correct answer is indeed A. So great job, everyone. Let me hand it off to Paris.
Thank you, Sean. Great job, guys. So let's take a look at this. This is definitely one of those tougher questions whenever we start talking about statistical tests. So let's take a look here. So this was analysis of variance, also called ANOVA, okay? And actually on the next slide, Sean has gone ahead and pulled up a very important table that we should definitely know for our exam, talking about common statistical tests. You can see there that ANOVA checks the differences between the means of 3 or more groups. So a couple important things there. One, it's comparing the difference between means, okay? And then also 3 or more groups. This is in difference to a t-test right above it, which is also looking at means, but it's between 2 groups, okay? And if you look at the bottom, this is kind of when I was saying it's important to look at the outcome that you're measuring and what are the variables. So in this situation, we had a numerical outcome, okay? This was looking at time to resolution. That's a numerical thing, as opposed to categorical, yes or no kind of things. that would be more of, depending on the size, that would be either a chi-square or a Fisher's exact test, okay? So because this is a numerical variable, it would either be a t-test or an ANOVA depending on how many groups we had. And we had 3 groups, so ANOVA would be better than t-test, okay? Let's take a look at the other answer choices, though. And I know they kind of went into a little bit of detail. So one, let's talk about a z-test. A z-test is actually very similar to a t-test, but it's used when the sample size is large and when you kind of know the standard deviation among that population. So kind of more in large samples is when you would use a z-test, okay? Otherwise, use a t-test. Now, between D and C, between an independent and dependent t-test, that's kind of depends on if you're comparing the means at the same time or different times. So an independent t-test is when you would analyze the means in 2 groups at one time, versus a dependent t-test is you're analyzing the mean of 1 group at 2 different times, okay? So it kind of depends on, are you looking at it at 2 times or 1 time? And then we talked about chi-square and we talked about an ANOVA test. So hopefully that review helped you guys. Clearly you guys did well on this question, so great job. We have 1 more question left to go through.
Excellent. Yes, 1 question left. Let's try to finish strong. Here we go. Beginning with the lead-in. Which of the following age ranges most accurately describes when this reflex is considered an abnormal neurologic finding? Which of the following age ranges most accurately describes when this reflex is considered an abnormal neurologic finding? I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. I see somebody asking, can we get advice on how to best use RX360? You absolutely can. We encourage you to visit firstaidteam.com and our YouTube channel. All right, I see the responses coming in. Let's go ahead and read that vignette. A 2-month-old male infant is brought to the pediatrician's office for a routine well-child visit. The infant has been eating, growing, and behaving normally for his age. Stroking the bottom of the patient's foot causes a big toe to move upward and the other toes to splay out. Which of the following age ranges most accurately describes when this reflex is considered an abnormal neurologic finding? And if you veterans in the group are recognizing this question, it is because we have actually done this question before. So with that, let me hand it off to Paris.
Thank you, Sean. So we will go ahead and show you what we think are the important clues in this vignette and the lead-in. And the reason we're doing this is that hopefully with this practice, you can kind of get a sense of, what do we think are important and what do we think is not as important, that doesn't need to be highlighted, so that when you go back and look at the question again, you can really just have a concise, relevant highlighting there to look at. So hopefully that practice was beneficial for you today. So let's go ahead and take a look at what we think was important here. So a 2-month-old male. So this is a very pediatric type question. And then they give us some information about how he's eating, growing, behaving normally. And then they ask us specifically about a physical exam maneuver. And then the lead-in is asking us a pretty lengthy question, but in regards to this reflex, what age range most accurately describes when it's considered abnormal neurologically? Okay, so that's probably it's a long question stem, but it's important. So how many steps are we working with? Well, I think probably a 2-step question. I think first we need to figure out what this reflex is, and then 2, we need to figure out at what age range, at what point is it considered pathologic or abnormal. Probably a 2-step question. Let's take a look at those answer choices. Answer choice E after 4 months, D after 3 months, C after 24 months, B after 2 months, and A after 12 months. So we'll go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
All right, this is our last question of the evening. Keep in mind that after this, we do have something to show you and a very special offer and a raffle. for one lucky winner. So make sure you stick around because you must be present to win. All right, a few more seconds here. It looks like there's already a clear favorite. All right, let's take a look and see what you selected. In first place with 54% was after 12 months, and in second place with 33% was after 24 months. So let's take a look. And the correct answer is indeed C, after 24 months. And 33% of you got it right. This is a challenging question. Let me go ahead and hand it off to Boris.
Thank you, Sean. Yeah, definitely a tough question. And I think I know where a little bit of that confusion comes from. So let's talk about it with this question. So as I'm sure you guys picked up on, this is known as the plantar, aka the Babinski reflex, where stroking the sole of the foot leads to dorsiflexion of the big toe and fanning out of the rest of the toes. So this is often a sign of neurologic pathology in older children and adults. However, it's normal finding in children younger than 2 years of age or 24 months because they have incomplete maturation and myelination of that corticospinal tract responsible for this reflex. So once again, those less than 2 years do not have full maturation and myelination of the corticospinal tract. Okay, there are some other primitive reflexes that we should know about: the Moro or startle reflex, the grasp reflex, rooting reflex. I think, generally for a good majority of patients, for infants, the Babinski reflex does disappear by 12 months. However, it's not considered pathologic until it's present after 24 months. So if you look at a lot of the studies show that after 24 months is when it's indicative that there is some underlying pathology, and the actual myelination is not complete until 2 years. So I think the confusion was that usually it often disappears by 12 months. However, it's not considered abnormal or pathologic unless it persists after 24 months. So a tough question here. Hopefully kind of working through this question and the other questions was helpful for you guys tonight with this topic. And I will hand it back over to you, Sean.
Excellent. Thank you very much, Boris. So we do have a list of our QIDs. These are the question ID numbers of the 4 questions we did this evening. If you have access to our question bank, you're welcome to take a picture or write these down. You can simply type these QID numbers into the RX search field and review these questions again on your own time.